If you are enrolled in the IGNOU MAPFHS program, one screen decides whether you even write a project this year, because unlike most IGNOU master's degrees, this one does not force a project on you at all. IGNOU MEDSP-071 is the project work course of the Master of Arts in Population and Family Health Studies. And in the next few minutes you will know exactly whether you need it, how to choose it correctly, and how to get it approved on the first attempt. Here is the direct answer. MEDSP-071, Project Work, is an 8-credit elective course in the second year of the IGNOU MAPFHS program. It is evaluated entirely through a written project report, and it is one of 5 electives you choose out of 7 available second-year courses. It is not compulsory, it is not a theory paper, and it is not the same course as MEDS-071, which is a completely different Year 1 theory course. We will untangle that confusion properly in a moment. Let's lock in the key numbers first. 8 credits. Evaluated 100% by the project report. Minimum 40% required to pass. An elective, chosen from 7 options in Year 2. Now the program itself. IGNOU MAPFHS stands for Master of Arts in Population and Family Health Studies. It runs under the School of Extension and Development Studies, SOEDS, and it was launched from the January 2024 session. It runs a 2 to 4 year completion window, admitting students in both January and July sessions. Eligibility is simple. A bachelor's degree in any discipline, medium of instruction is English, and the whole program totals 80 credits. SOEDS designed MAPFHS for 2 very different kinds of learners at once. Fresh graduates who want a career in population, health, or development work, and in-service professionals already working in that space. That second group is wider than most students expect. Village development officers, medical and paramedical staff, Anganwadi and ASHA workers, health inspectors, block extension educators, municipal and Nagar Panchayat functionaries, school teachers, and NGO or corporate social responsibility employees working on population and family welfare are all named as the program's target learners. Now let's clear up the 5 things students get wrong most often about MEDSP-071. Myth 1. Students assume the project is compulsory. The way it is in many other IGNOU master's degrees. It is not. The official MAPFHS program guide states this directly. The program offers project work as an elective and not as a compulsory course. You opt for it as one of 5 electives in the second year, alongside 6 other theory options. If field research does not suit you this session, you are allowed to skip it and choose 5 theory electives instead. Myth 2. And this is the single most common mix-up in this program, MEDS-071 and MEDSP-071. Look almost identical, but they are 2 completely different courses. MEDS-071. Without the P is Introduction to Population Studies, an 8-credit compulsory theory course in Year 1, with assignments and a term-end exam, MEDSP-071. With the P is Project Work, an 8-credit elective course in Year 2, evaluated only by a report. The P stands for Project. When you fill any form, write the address on your envelope or search online. Always double-check for that single letter. Myth 3. A lot of general IGNOU guidance online tells every student to expect a viva voce, an oral interview, after submitting a project. For MEDSP-071. Specifically, the official program guide's evaluation section lists 100% weightage on the written report alone, 40% to pass, with no viva in that scheme. That is consistent with how other SOEDS project electives are evaluated. Practice can still vary by regional center and by session, so confirm the current requirement with your study center or the program coordinators before you assume either way. Myth 4. Students think their research skills for the project come from nowhere and panic about methodology. They don't come from nowhere. MEDS-075, Research Methodology in Population and Family Health Studies, is a compulsory Year 1 course, and its 5 blocks cover exactly what a project needs: research design, measurement and sampling, data collection, data analysis and monitoring and evaluation of projects and programs. Go back to that course material before you write your synopsis. It is your project's training manual, even though nobody labels it that way. Myth 5. The fee figure floating around online does not always match what you pay today. IGNOU's live MAPFHS program page currently lists 7,000 rupees per year, 14,000 rupees for the full program. The original 2024 launch program guide had quoted 6,000 rupees per year, 12,000 total. Fees have clearly been revised upwards since launch, so always confirm the current figure on ignou.ac.in or on Samarth before you pay, rather than trusting an old screenshot. With the myths cleared up, let's map exactly where MEDSP-071 sits inside your 2-year MAPFHS structure. Year 1 is fixed. All 5 courses are compulsory, 8 credits each, 40 credits total. MEDS-071, Introduction to Population Studies. MEDS-072, Population Theories, Policies and Programs. MEDS-073, Social Groups and Family Health. MEDS-074, Population and Development, Issues and Challenges. And MEDS-075, Research Methodology, the course we just flagged as your project's foundation. Year 2 is where you choose. 7 courses are on offer, and the program guide's own instruction is simple. Choose any 5. MEDS-047, Ecology, Environment and Urban Development. MEDS-076, Public Health and Nutrition. MEDS-077, Urbanization and Urban Development Challenges. MSOE-002, Diaspora and Transnational Communities. MWG-111, Women in the Economy. MANE-004, Gender and Society. And MEDSP-071, Project Work. Pick any 5 of these 7, and the project is simply one candidate among them. So when should you actually choose the project over a 6th theory paper? Choose MEDSP-071 if you can genuinely reach a population, a community, or a dataset for original data collection. If you enjoy field research more than sitting for a term-end exam, and if you want a report that becomes a real, usable writing sample for population or health sector jobs, choose a theory elective instead if fieldwork access is a real constraint for you this session. Or if you simply prefer the structure of assignments, plus a term-end exam. Either path completes your 80 credits. There is no wrong answer, only the answer that fits your circumstances. Here is how the whole program is graded, so the project's 40% pass mark makes sense in context. Theory courses need 40% in the assignment and 40% in the term-end exam. Separately, the project needs 40% in the report. And that is the only number that matters for MEDSP-071. Above that line, the letter grades run from D for satisfactory at 40 to 49.9%. Through C, good, and B, very good, up to A, excellent at 80% and above. Now the complete MEDSP-071 project lifecycle, from a blank page to a submitted report, in 6 practical steps. Step 1. Topic selection. MAPFHS does not hand you a fixed topic list the way some other IGNOU programs do. Instead, your topic should grow out of the subject areas you have actually studied. population dynamics, fertility, mortality and morbidity and migration from MEDS-071, population policies and health programs from MEDS-072, gender, aging, high-risk behavior and healthcare systems from MEDS-073, poverty, food and nutrition security, urbanization and water and sanitation from MEDS-074, and whichever 4 theory electives you choose alongside the project in Year 2, whether that's nutrition, urban challenges, diaspora, gender, or the economy. Run every candidate topic through 4 questions before you lock it in. Can you name the exact population group you will study? Can you reach that group for genuine data collection within your available time? Does the topic connect to at least one course block you have actually read? And is the scope honest, one clearly defined area, not the whole country? If any answer is no, narrow the topic further before you write a single line of the synopsis. Here are researchable directions, grouped by theme, from the MAPFHS course structure: fertility and reproductive health, contraceptive awareness in a defined community, or antenatal care seeking among pregnant women in a block, mortality, morbidity and nutrition, child nutritional status in an urban slum, or communicable disease awareness among a specific occupational group, migration and aging, the health and care burden on elderly family members left behind by out-migrating workers, or the health-seeking behavior of return migrants, urban health, sanitation access and health outcomes in an informal settlement, or occupational hazards in an unorganized urban trade, gender and welfare, women's access to public health schemes in a rural block, or awareness of maternal entitlements among Anganwadi beneficiaries. Let's carry one worked example through this entire video, so every step below has a real anchor instead of a vague description. Our example title is, quote, "Migration and the Health-Seeking Behavior of Left-Behind Elderly Family Members in Muzaffarpur District, Bihar," end quote. It deliberately combines the migration unit from MEDS-071, the aging and healthcare unit from MEDS-073, and, if chosen as a Year 2 elective, the public health themes of MEDS-076. Notice why this title works as a piece of researchable writing. It names an exact population, left behind elderly family members. It names an exact place, Muzaffarpur district. It names an exact phenomenon to measure health-seeking behavior, and it is grounded directly in course content the student has already studied, not an idea copied from a random website. That is the pattern to copy for your own topic, whatever your subject actually is. Step 2, your project guide. The MAPFHS program guide does not publish a separate, detailed supervisor eligibility list, the way some other IGNOU programs do, as a working standard. A postgraduate qualification in population studies, sociology, social work, public health, geography, economics, or a related field, ideally with research or field experience, college or university faculty, research institute staff, or qualified professionals in the health or development sector are all commonly accepted. Always have your specific guide's eligibility confirmed by your study center coordinator or the program coordinators before you finalize your synopsis, since exact rules can be interpreted locally. One more resource most students never use. The program provides one dedicated counseling session for project work at your study center, in addition to up to 6 sessions per theory course. Carry a draft topic there and leave with practical feedback before writing your formal synopsis. Step 3. The synopsis, the short proposal that must be approved before you write a single page of the full report. Build your MEDSP-071 synopsis around these core sections, following the general IGNOU project proposal pattern: title of the study, background and rationale, why this topic matters, a clear statement of objectives, a short review of relevant literature, your proposed research methodology, sample, tools, and data sources, an expected outcome or significance statement, a tentative chapter outline, and a preliminary bibliography with your guide signature and biodata attached. Applied to our worked example, the objectives could read like this. 1. To study the migration pattern of working-age household members from the selected villages of Muzaffarpur district. 2. To examine the health-seeking behavior of elderly family members left behind in migrant households. 3. To identify the specific health and care challenges faced by this left-behind elderly population. And 4. To suggest practical measures for improving their access to health services. Step 4. Where the proposal actually goes. And this is a detail many students get wrong. It does not go to your regional center. The official program guide is specific. For project work-related information and for information on academic matters, contact the program coordinators, MAPFHS, School of Extension and Development Studies, Block 15F, IGNOU, Maidan Garhi, New Delhi 110068. The listed email is soeds@ignou.ac.in. As of this recording, the MAPFHS program coordinators listed on IGNOU's official program page are Dr. Sada Prasad and Professor Grace Dawn Nemching, both of SOEDS. The launch guide also names Professor B.K. Patanaik. Coordinator names change with faculty postings, so verify current names on the live ignou.ac.in page first. So what does your regional center actually handle? Identity card issues, fee receipts, change of address, bona fide certificates, migration certificates, and non-receipt of study material. Project work approval and academic queries go to SOEDS at Maidan Garhi directly, not through the regional center. Keep that distinction clear and you will save weeks of misdirected correspondence. After you send your synopsis, wait for a written approval before you commit to full-scale data collection. If weeks pass with no response, a polite, well-documented follow-up email to SOEDS with your enrollment number and topic clearly stated is entirely reasonable. Keep a dated copy of everything you send as your proof of timely submission. Once your synopsis is approved, it's time to actually collect data and write the report. Step 5 covers methodology. Step 6 covers the report itself. Step 5. Choosing your methodology. Most MAPFHS projects fall into one of two broad approaches. A survey-based study, where you design a structured questionnaire or interview schedule, sample a defined population and analyze the responses statistically, works well for questions about awareness, behavior, or access to services across a group. A case study or qualitative approach using in-depth interviews, focus group discussions, or secondary data from government and institutional reports works well when you are studying a smaller, specific community or a single scheme in depth. For our worked example, a mixed approach fits best. A structured interview schedule administered to elderly respondents in migrant households across a defined set of villages in Muzaffarpur district for the quantitative picture combined with a small number of in-depth interviews with a few respondents and their local ASHA or Anganwadi worker. For the qualitative depth behind the numbers. 2 practical reminders while you collect data: always take informed consent before an interview, and never record a respondent's name or identifying details in your final report without their permission, and use secondary sources honestly. Census data, National Family Health Survey reports, and State Health Department data are excellent supporting evidence, but they cannot replace the primary data you are asked to collect yourself. Step 6. Structuring the report itself. A workable, widely used 5-chapter skeleton looks like this. Chapter 1. Introduction, covering background, rationale, and objectives. Chapter 2. Review of literature. Chapter 3. Research Methodology. Chapter 4, Data Analysis and Interpretation, usually your longest chapter, with tables and charts. And Chapter 5, Findings, Conclusions and Recommendations. Now, an honest word of caution on length. The MAPFHS program guide itself does not fix an exact word count or page count for MEDSP-071. The figure commonly cited across general IGNOU project guidance is roughly 10,000 to 15,000 words, or around 50 to 80 pages, excluding appendices. Treat that as a sensible working target, not an official rule, and confirm the exact expectation with your guide and the program coordinators before you finalize your report. For the exact page layout, font, spacing, certificate pages, and reference style, follow IGNOU's General Project Format Standard, A4 paper, a clear font at 12 point, 1.5 or double spacing, proper margins for binding, and APA-style references. Our dedicated IGNOU project format video walks through that chapter by chapter, so check the link and pinned comment instead of us repeating every margin measurement here. Step 7. Submitting the final report. IGNOU now accepts project reports almost entirely through its central online project submission portal, activated separately for each session. You scan your complete report into a single PDF, including the approved synopsis, your guide's biodata, and a signed originality certificate, and upload it through that portal. Reports sent by email are explicitly not accepted for evaluation, and incomplete uploads are removed from the portal once the deadline passes, so double-check every attachment before you submit. Deadlines follow IGNOU's standard 2-session pattern, broadly 31st May for the June cycle and 30th November for the December cycle. Though exact portal dates are announced each session, so confirm them on ignou.ac.in. There is also a project evaluation fee, generally 500 rupees for projects above 4 credits, which MEDSP-071 is, paid along with your term-end exam form. Confirm the current amount at the time since university fees are revised from time to time. To recap evaluation in one breath, report submitted. Evaluated by the university, 100% of your marks come from that report. 40% is the pass line, and if your regional center schedules a viva for your session, prepare to explain your objectives, your methodology, and your key findings clearly in your own words. Before the FAQs, here are the mistakes that most often send an MEDSP-071 project back for correction. 1. Sending the synopsis to the regional center instead of SOEDS at Maidan Garhi. 2. Confusing MEDS-071 with MEDSP-071 on forms and envelopes. 3. Starting full data collection before the synopsis is actually approved in writing. 4. A topic so broad it names no specific place or population, such as, quote, health of women in India, end quote. 5. Missing the guide's signature, biodata, or originality certificate in the final upload. 6. Uploading the wrong file to the portal, such as an assignment or a synopsis instead of the final report. 7. Submitting by email, which the university explicitly does not accept for evaluation. 8. Secondary data copied wholesale from a website without proper citation, which risks a plagiarism flag. And 9. Leaving submission to the very last week of the deadline, when the portal is busiest and most likely to have technical delays. Now, the question every student actually wants answered: is the IGNOU MAPFHS project worth it? Is it hard? It is manageable if you treat it seriously from day one. Pick a topic you can genuinely research, get the synopsis approved before writing the report, and follow the IGNOU format standard from the start. Most of the difficulty students report comes from starting late, not from the research itself. On career and validity, MAPFHS is a recognized MA degree from a central university under UGC's Open and Distance Learning Framework. Valid like any recognized MA, subject to your employer's own eligibility rules. IGNOU's own prospects note points toward roles at the grassroots, supervisory and middle management level in government and non-government population and health departments, with stronger prospects for in-service professionals aiming at senior roles in population, health and family planning work, and openings in NGO, CSR, research and advocacy roles in the wider development sector. Here's why the project version of your Year 2 credits is worth genuine consideration. A real field-tested report, in your own name, on your own data, is direct evidence that you can plan a study, collect data ethically, and turn it into recommendations. In population and development work, that is exactly the skill employers check for, and a stronger interview asset than one more theory paper's grade. Let's move quickly through the questions students actually type into Google about MEDSP-071. Is MEDSP-071 compulsory in MAPFHS? No. It is one of 5 electives you choose from 7 Year 2 courses. You may complete the degree without ever writing it. Is MEDS-071 the same as MEDSP-071? Number MEDS-071 is a Year 1 compulsory theory course Introduction to Population Studies. MEDSP-071 is the Year 2 elective project. Where do I send my MAPFHS synopsis? To the program coordinators, MAPFHS, SOEDS, Block 15F, IGNOU, Maidan Garhi, New Delhi, 110068. Not to your regional center. Is there a viva for the MAPFHS project? The official evaluation scheme lists 100% weightage for the written report only, with no viva listed. Confirm current practice with your regional center, since local practice can vary. How many credits is MEDSP-071? And what is the pass mark? 8 credits, and a minimum of 40% in the project report to pass. Can I choose my own topic for MEDSP-071? Yes. There is no fixed topic list in the program guide. Choose a focused, researchable topic connected to your coursework and get it approved by your guide and SOEDS. Is MAPFHS worth it for working professionals? IGNOU designed it specifically for in-service professionals already working in population, health, and development roles, alongside fresh graduates, so yes, subject to your own career goals and employers' recognition rules. Let's bring it all together with the master rules for MEDSP-071. Rule 1. It's an elective, not compulsory, one of 5 choices from 7 Year 2 courses. Rule 2. Never confuse MEDS-071 with MEDSP-071. Rule 3. It's evaluated 100% by the report, 40% to pass, with no viva listed in the official scheme. Rule 4. MEDS-075 is your built-in methodology training. Rule 5. The synopsis goes to SOEDS Block 15F, never to your regional center. Rule 6. Get written approval before full data collection. Rule 7. Submit only through the official online portal as one complete PDF, never by email. Rule 8. Confirm exact word count, fee, and deadline directly with SOEDS each session, since these details are revised over time. If you want personalized help choosing your MEDSP-071 topic, structuring your synopsis, or reviewing your draft report, message us on WhatsApp using the number on screen and in the description. For the universal IGNOU project format, our synopsis guide, and how to find and confirm the right project guide, check the linked videos. That's the complete IGNOU MAPFHS project guide for MEDSP-071. If this saved you time, subscribe to Sri Chakradhar Education for the rest of our IGNOU project library, and drop your topic in the comments if you would like a second opinion on it.